Bonjour, Wejmo Kaknodan Kwe Nadishnakas, Megazay and Odem, Potawatomi and Dow, Shaw and Dasa and Dow, Kwewa Nama Taata, Kwewali, Pa, Lachache, Hotape Lathali, Shamsa Palethi, Shwano Kwe, Nishnabe Kwe, Sadasepe, Ohio, Piqua. What I said there was my traditional greeting, which is the fact that I am my spirit name, which is I don't often share, and probably I guess I won't share because we are recording. And open circle, I don't normally, and unknowns. But anyways, I am Potawatomi, for those that don't know, from the Michigan territories, or Michigan. And then Ohio lands, I'm Shawnee from my mom's side, and southern area, and I go there quite often. So I wanted to take some time to kind of settle, because I get a little worked up, and I just wanted to take some time. And I know some people, I've seen some things where people say, yeah, we're just all kind of doing land acknowledgements, and that's, some people were making like it wasn't. I think it's important, in my opinion, and I wanted just to acknowledge the land that I'm on, which is my father's lands, his homelands, which is the Potawatomi lands, and where all you are at. There's so many, I don't even know where you're all from, and I'm so honored that you're all here, and welcome. I'm very honored you took time out of your day to be here. I'm not used to this whole Zoom format and not being able to hear you and just talk. We will have a time at the end. I guess some of you may be familiar with a format of you sharing. So if I say something that resonates or doesn't resonate, write it down and we can discuss it at the end. And I'll take a moment to, I put tobacco down a minute ago. I went outside, asema, to my ancestors in prayer. And I just want to take a little bit of time for prayer, not to negate it, but to we did the land acknowledgement, and I just wanted to say, Chimigwech Gajamdo, Kiwa Kumale, Kima Kumale, Lena Wanape, Lena Wanape, Lena Wanape, Kiwa Kumale, Gijamnado, for all that you've given to us. I want to honor all of the women here present that give up much of their time, of themselves, from their families to help other women and these new little spirits that come into the world. And I say miigwech for the knowledge, miigwech for the waters, miigwech for the land, miigwech for the medicines, in all four directions where all of you are at, and miigwech, aho. The other thing I wanted to say before I get started too, I'm gonna pull up my screen. I do a PowerPoint, and I don't want to PowerPoint people to death, because I know people get a little like, PowerPoint. Where did it go? There it is. But I need PowerPoint to, first of all, slow myself down. PowerPoint to prevent me from, I call it swirling, because I talk fast and there's so much stuff I want to say. And sometimes I get lost in translation or lost in where I'm at. So whatever it is that you need to do to take care of yourself during this time, please do. I'm smudging and drinking my chocolate tea right now. So my introduction, I always struggle with, in the sense of my let's just say my Western way of introduction, just because I don't want to, I don't know. I don't know. I'm trying to be, I'm honored to have been able to be in the situation that I'm in with mamas and babies. I come from a line of midwives. I wasn't aware of that when I first started, but in 1985, when I became pregnant with my first child, had transitioned from oncology. I'm a nurse by trade in the beginning, and I went on to I went from oncology after 2 years to labor, and I don't like. Personally, my struggle is I would love all of us if I leave this world tomorrow. My words that I would love for all of you to take is the word labor and delivery. I struggle with the word delivery. So those, if you go to a hospital setting, I would love for it to be labor and birth rooms, because nobody's delivering anybody a package. We're working hard as women, and we're birthing forth something beautiful. So I went to a labor and birth unit and started working there in 1985. Like I said, when I became pregnant with my first born child, or first for him to come. Um, and uh, met my first certified nurse midwife, which she was working in the hospital, and it intrigued me because I had learned from my mother's mother about my lineage of lay midwives in the home, going to do home birth and what have. And she's actually Coastal Salish, and I know very little about the historical pathway of her. Coming back and forth. She was in the Carlisle boarding, my great great grandmother was in Carlisle boarding school. So little knowledge was transmitted from her about the Coastal Salish way of being. So I don't want to step on anyone's toes and say I'm Coastal Salish, however I am. So I want to start owning that at some point. So I went from there in 85, and then it became a fast forward, became a nurse midwife in like 92, and I became a certified nurse midwife. I struggled with that decision because I am Indigenous. My way of being is in the home. Obviously, there's 20% of birth that needs to be in hospital or would benefit from hospital versus the 80% that I believe should be in the home setting or in a birthing center. And so I went that route so that I had that training, that degree, so that I could go do those births. And also in Michigan, because it's let's see, in Michigan, it's legal to do home births. It's just not politically correct. So I wanted to be able to do both, which is what I did and have done and continue to do. Not as much as I used to. But I've since 1992 have been able to assist those spirit beings coming from what I've been taught as the star realm, those little ones coming into our, coming earth side. So 1327, and the last one was my last grandchild, which is my grandson, and completely honored. But it was a very interesting situation, which we could talk about at some point, but that's not why we're here tonight. However, it was beautiful to be in that moment and in that time. So, and there's one other person on the call that I've been present for hers. And so those moments in time are, as you all know, are things that just we're honored because we're in this intimate setting, we're in someone's home, and we need to be respectful and realize that we're in a time of honor. I did find, and I always like to mention that coming from an oncology situation, a terminal oncology situation, that I thought, okay, I can't handle this much anymore. And I thought full spectrum. However, the sights and sounds and smells are so similar because a spirit is leaving and a spirit is arriving, and those things seem to do this. And they taught me so much to be able to be in those two worlds. So we can do an introduction later if we wanted to for the attendees. I guess I kind of didn't realize we were doing the silence, which is fine. I would like to talk a little bit about placenta function, though most of you know, probably a little bit more about that, and the cultural traditions of the placenta after it comes, and the ceremony that comes with that. And I'm going to do kind of an overview because it varies so greatly across Turtle Island. I will speak on what I know. I will also talk, because I do like to discuss, and I found, you know, some very cool pictures that show the interconnection, at least I think they're cool, the interconnection of everything, and that placenta, and that the tree roots. So the placenta is the tree of life, as we call it. And then I did ask for, it's hard to find interpretations of that word placenta and birth, and it's hard. People look at me like, I don't know those words. I don't know. I've never heard those words. And I did ask, and I will say, Rayanne, earlier, what is that word? And so a placenta. So I'm going to try my best to interpret that for you. But the interconnectedness, I feel, is very important. I do want to specifically talk a little bit about what happens in institutional practices with placentas if we are in a hospital situation. So to be astute, if you're a doula or an Indigenous person in the room, I was going to say Indigenous midwife, however, that would be not happening as in the birth situation, but you could be present and to be that voice and to watch that placenta so closely as to where it goes. And again, we'll have the discussions afterwards. So put your questions in the box if you need to, but we'll move ahead. So we'll go ahead with a little bit of placenta. I don't know if we need to, how far we need to go in. The one I wanted to share is the I can't see it now, but the little on the right hand side of the screen, I'm hoping it's on your right hand side, the little tiny baby, the little fetus over there, the panogiac developing. So Gadabe Benoje Shen Zem, so placenta ceremony. So placenta is Gadab Benoji Shen Zem. Oda Pik Washamon Jaga We Idigwag in Anishinaabe Moen. And that's just how we say here. And that actually means, according to as I was taught, the placenta part of it, the Gada Benoji Shineth Miss Oda Pik Wesh Shimman is baby's pillow. And I wanted to talk a little bit about that with we can talk about physiology and all of that goes on with implantation. You see where it looks, this is why I wanted to show this picture, because we know, the two arteries, the one vein, everything's, happening. Most of mama's giving baby good nutrition, new nourishments, all that they need, and then baby is exiting out and taken away. Baby also has, with the urine and the amniotic fluid, that's where some of that amniotic fluid comes from. But I love this little diagram here because it shows, remember this, I guess, because I want to show some pictures of how that looks like, the connection to the trees and the tree roots and how we're rooted to each other. What I find very fascinating, I love the part of this is that when conception happens and that baby in the star realm sees two people in love, and that moment in time where this occurrence is happening together, they say, I want to be with that family. I want to be with that mom and dad. And they choose that mom and dad. They choose their mothers and fathers from the star realm or the partner. So however that family unit looks like. And so when the baby it starts to develop, it is called a blastocyte. And I wish I could find a different word to describe it, because I feel like that sounds so technical, and it is. But that little tiny blastocyte, that little tiny beautiful spiritual being, that spirit being that has come from the star realm into being, has to travel down and embed into the uterine wall in a safer space, up higher hopefully than down lower. And when that embeds into the endometrium, it starts to grow. And our bodies as women have to accept that being, in the sense of, it is a foreign body and it is growing within us, and that generally doesn't happen. Our bodies usually do not allow that to happen in our bodies. So this is miraculous from the moment that baby sees this family, and then also implants or embeds into that uterine wall. And that's the endometrium. Sorry for those that, if I said endometrium, so the uterine wall. And so it will embed. And I do like to, remind people at this point that during that time that it embeds or plants itself, seeds itself into, I don't like to use some of these technical words, but seeds itself or settles itself into the uterine lining, the endometrium, that it starts to grow. But once the minute that it embeds, the mother may see some light spotting, and it scares them because it's early in the pregnancy. So those of you caring for mamas and in this time frame, if you get that phone call, be aware that there's that time period, that may be some light spotting, and that's normal. But they should be in tune to watching what's happening with that spotting. And that's a whole nother topic after that, but be aware of that. And I have at the bottom of the slide of stem cells, and that could be a discussion at the end, because I don't know, I guess I would say I struggle with that. So that's just kind of a brief overview of the physiology of that beautiful moment, that sacredness. And when the amniotic sac develops, not only does the baby have its own little special sacred pillow, the amniotic sac that it's in is considered the first sacred blanket that covers that baby. And there's so much hormonal happenings within that, just the amniotic sac itself. So now you've got this beautiful little unit being cared for by the mother. And also a part of the physiology that I didn't mention was that the baby actually gives to the mother as well. So if the mother is sick, especially in heart situations and what have, the baby will send off hormones or antibodies, whatever, to also protect the mother. They've also shown studies that this little fetus will also release through their stem cells and all that's going on for the mother later in life to prevent Alzheimer's, cancers, those types of things. And there's so much that we don't know about, but it's that interconnectedness that we'll talk about later that I find fascinating. And I don't believe we need to know all of it. We just need to know that we're all connected. So with the placenta, the umbilical cord, and the umbilicus, which is the belly button area, this is like a sacred triad. Extremely important. These all work together, again, all interconnected. Those of you working with mamas, really get them to understand. This took years in the hospital to get to stop, was to allow the cord to stop pulsating. There's so much coming through there that the baby needs. And even if baby is in distress after birth, that baby needs that oxygen. So not allowing them to cut and clamp the cord, watching, being that guardian of the mother and baby unit, tell them you don't want that disconnected, because the baby can be resuscitated on the mama if so needed, and it really needs that oxygen that's in that cord, and that while it's pulsating. So let it stop. The issue is if you're in the hospital, um, sometimes you get busy with other things, and so make sure someone has their eye on the placenta and where they've taken it and what they're doing, because sometimes they just whisk it off without even saying a word, even though you've told them not to. So someone needs to be kind of responsible for that placenta. Like I said, it's the tree of life. I'll show some slides in a minute. It's a grounding force. We saw how it grounded into the endometrium, the uterine lining. And it is that connection, the placenta and the umbilical cord and the amniotic sac to the earth and the spirit realm. So all of it is connected together, and there's communication going on between the spirit world, star realm, and this water realm that the baby is in for over 9 months. I like to put in there that the word for placenta in Dene language, as I've been told, I'm not Dene, so I've just been told this, it is the same for land in their language. In a lot of like I said, I'm going to do kind of a world view on some things. Placentas are frequently seen as the twin of the child that is alive when it's born, and when the placenta's work is done, it's respected and wholly held in complete reverence and honor and respect as a life giver. And now that work is done, and it's the twin to that being that has now come forth earthside. And that's why when we get to the ceremony, it's important, because that connection to that twin, the placenta, they feel that this baby that came earthside and is breathing and living with us is so still connected to their placenta. And it's also in some places considered the mother of that baby. So it's fascinating to see similarities, differences, and I would love for some of you to jot down some things that you know and share if you so feel like it. That would be wonderful. And like I said, we talked about the baby's pillow and that sacred first blanket covering. I don't want to forget to mention too, and I know a lot of this isn't quite just placenta ceremony, but that the head of the baby is very, very sacred in the sense of the soft spots, we call them. I always tell people to be very cautious and careful with those soft spots afterwards, and rub those areas, because that's what I've been taught by my elders, and that this is where the direct communication continues to the star realm, to the ancestors, after that connection of the umbilical cord has been severed or stopped. I don't like the word severed, but is no longer connected. So the umbilical cord too is an important thing to discuss in all of this, because this all again is interwoven, interconnected, and it has the three vessels, which is the replication of the triad of the mother, father, child, or mother, however your family unit looks. And that unit is, there's three people involved, and you have to have, I'm pretty open, and you have to have the egg, you have to have sperm to have a baby, and then so that unit and the child, so it's that replication of the triad. So it's kind of it's kind of twisted. You'll see it's twisted. It looks like a rope. It resembles the birth ropes that can be used to pull down on when you're giving birth. It also looks like sweetgrass, and many people there's many teachings I have about the connection to the mom, father, and baby with sweetgrass braiding, and our hair braiding as well as women. So that to continue that connection. So I love that interconnected thought. And then again, we talked about the delayed clamping importance. Again, apparently that's really important to me. I will jump down to what I use when what I love to use, and I will probably always continue to use to tie off if the mother so chooses me to disconnect at some point. Some others want that to stay for a longer period of time, a lotus birth, and stay connected until it totally disconnects on its own. But to do the actual, I don't use a plastic clamp that you'll see, or a metal clamp, or whatever they provide you with. I use real sinew. Never, and I should knock on wood, but I've never had an infection. Quite the opposite. I use a sinew. And it is like a wicking. You got to tie it tight because it wicks so well, like overnight. If you have a really nice, beautiful, thick cord, it wicks off, and you'll see just the diaper is full of liquid from that the umbilical cord, and it dries off. It dries so quickly. So I try to use sinew. I'm all out of my grandfather's sinew that he gifted to me years ago, but I try to get the real sinew. There's fake sinew, you know, but I use the real sinew. Some tribes did bite it off back, you know, still today, more often back many years ago, they would tie it in two places and then bite it off instead of cutting it. There was a need for that. Some used obviously a sharp object to cut it, or used a stone to pop it. So then you have, I always try to tell my mamas, don't tie, or my providers and mamas, try to tie off with some distance from the umbilicus, the belly button, the all-important belly button, because that's going to fall off. And there's so many different teachings, and you should ask your own families, your grandmothers, your aunties, and your families as to what your families do. There's so many variations when that umbilicus falls off, and if it's too close to the belly button, you won't have as much to use. And again, if you're in a hospital situation, if you could ask them to cut, to do that up farther. Then if something happens to the placenta for whatever reason in the hospital setting, you still have a portion of that, which is your umbilicus, which you could take a little bit of that snippet and actually bury that versus the placenta during ceremony. So that's kind of an important thing to remember. But the practices vary so significantly across Turtle Island. And I would love to hear all of the different ways. Like I said, I had my babies had them tie it off. I provided sinew. It was tied off long and clamp, cut then between the two pieces. And then I put out for my daughter by the berries out here in my yard that I have for that helps ensure a young lady who will be good at gathering. She will be good at gathering, and some will put the boys near a well-known fishing area or a well-known hunting area. It all really depends on your teachings and your area of where you live. So we can discuss a little bit of that when we get towards the end. And I had an inbox message today about someone saying something about this. I'll get there, but so I use the word planting because my elders did not like the word burial. They wanted it to be planted. And I kind of like that, because the more I thought about it, at first, like, we're really burying it, but no, we're really planting it. We're grounding it. We're grounding this child by planting it into Mother Earth, into our homelands. And I had a young lady inbox me and say, the baby's getting restless. I think it's time to get the placenta buried. The baby's a few months old now. Is it appropriate for me to come north to bury it on my homelands? And I'm like, absolutely. What feels right to you? What feels right in your heart? Do you feel like that's time? Babies will be restless. I've been taught, my teachings are that when we take the time or have the ability to put the placenta into Mother Earth, and always remember your asema or whatever it is you offer first to your homelands before you dig. We use tobacco asema here. We put that down first. We dig our hole, and then we put the placenta down in there. And I'll talk about that in a little bit more length here in a second. But so it's important with the homelands, because they say that children that don't have this happen, they feel like they're scattered. They feel like something's missing in their life, and they don't quite know where they're supposed to be, and they're a little confused or agitated. And she feels the baby is a little agitated at this point, and she feels, and I always trust a mother. If the mother is telling me that she feels it's time to plant the placenta because baby's feeling a little agitated, I told her, absolutely, go ahead. And the place that she asked about, I said, yes, absolutely. So it's not where she lives, but it's where her ancestral homelands are at. So I also learned from one of my teachers, Dr. Casey Church, that out west, they attach a little bit of the umbilical cord to they tie it onto the horse's mane, and then they send the horse off, and it runs with the horse till it falls off. And that's important to them. But I that's all I know about that teaching. So if anybody else has anything on that wants to share later, that would be cool. What I'm finding really wonderful, and I'm loving this generation, you all are inspiring me, and I'm finally saying, yes, it's happening, is that these things are starting to happen more and more and more. And you are entitled. You are entitled. This is of you. The placenta is of you. It comes to you, and this is yours. And when if you're in a hospital, because unfortunately still most of us are giving birth, that's starting to change as well. It's going to take maybe a little more time, but and I'm going to say this, and some people in the medical world would disagree with me, but they do not need, even if you have an infection, or they tell you have an infection, they do not need your entire placenta. They can take a section of it if they want to check it out. You take it home, or say, okay, then I want my entire length of my umbilical cord. If you give them your umbilical cord for stem cell research, that is now your DNA, and they're going to overstudy it, because being Native, Indigenous, they overstudy everything. And so you have to remember that too. That is your direct DNA of that baby. So I always remind mothers of that. So please remember that placenta is yours, and you have every right to that placenta. So give somebody the voice to make sure, or the eyes to watch that placenta. And this is where I believe the Indigenous doulas play such an important part. They keep their eyes on that placenta, so it goes home. Bring a container, so they can't say we don't have a container. I'm not bashing the system to say that they're not, that they're not going to work with you, but many times they may not. So take a container with you. There is a container that comes, it's a plastic container in many hospitals, tall white container that comes with a birth kit. But you can use any container that speaks to you, and bring it to the hospital to take it home. They're gonna tell you it has to be wrapped in a biohazardous bag, and just, I always say, just go with it. I laugh about that because they should be wrapping the mother in a biohazardous bag as well as she's exiting the hospital then, because she's excreting the same stuff that's in that placenta still. But that's just a whole nother topic. However, please remember, it is yours, because the reason I say that is because what happens with our placentas, and that's the discussion about hospital use of our placentas, is that if a placenta is not taken home by the mom, they're sold to pharmaceutical companies. And again, first and foremost, research on the placenta. And then what happens is, many times, and if you look, you can look on bottles of facial products in particular, it'll say placenta, the French word, and they sell it to pharmaceutical companies, make a lot of money on your baby's placenta, your placenta. And now I will tell you, when I worked in the hospitals in 85, 86, 87, doing this work as a nurse, the place I took the placenta to was a morgue, which I said, I can't do this anymore. Someone else has to take it down there, because I couldn't go. It was so cold. And it's like, you want me to put it here? Yes, because they'll come, they're going to pick it up, they being the pharmaceutical company. So please remember that. It happens still today. And so one of my mamas did tell me that her placenta, she told them she wanted it. They said they couldn't. Her baby came a couple weeks earlier than the term of 37 weeks, so she could have it later. And I worked for over a year, because she called me and she said that it was sent to a local funeral home near the reservation, and she had to pay $40 to get her placenta back. And I'm like, no. So I called the hospital where she gave birth, and the nun talked to me, and we went back and forth for over a year. And I wasn't going to give up. And finally I said, look, we've had enough. This has been a beautiful conversation. We've developed this wonderful relationship on the phone. However, this placenta belongs to her. She should not be paying for it. And none of my mothers should be paying for this. And I said, this is our ceremonial rights. And please, all of you, remember, all you have to say is, I'm done with this conversation. Our lawyers will talk to your lawyers, or my lawyer will talk to your lawyers. And there was dead silence when I said that. Now, mind you, I've talked to her, I guess it was 18 months, honestly, not a year, it was 18 months. Within a day, she called me back and she said she can have the placenta. She doesn't have to pay for it. She just go get it. And I'm like, oh, okay, well, thank you. Oh, sorry, I missed a part. So I had told her, I said, this has been a great conversation, great relationship building. I said, however, my lawyers will call your lawyers. She said, why would your lawyers get involved? I said, this is our ceremonial rights. This is our religious freedom. And we have an act, the Native American Religious Freedom Act, 1979. And this is a part of that act. And you are now, this is illegal for you to withhold these placentas. And so within a day, that changed, and they were giving placentas back to the mothers for free. The other mother was able to go get her placenta, and they promised and they never did send another one to the morgue nor the hospital or the funeral home. So don't back down. Know your rights, and I can't say that enough. So my experience with my grandchildren's placenta, because a lot of times in many ways it's the grandmothers or a grandmother figure or an auntie who are responsible for planting the placenta. So my one grandson, who a lot of you that know me on Facebook, little Owen, red-haired, I think he looks like Ed Sheeran and Chris Farley mixed together. He's their love child. Anyways, his mama got married out here on the farm. And I kept thinking that the placenta needed to go out near where they got married. And I kept hearing this voice in my head, no, 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 take it back towards the house. I'm like, no, no, no. I kept arguing with spirit, right? So finally I gave in, went back towards it told me exactly where to go. And I went back to the house and I put down my asema, my tobacco, and I dug. And you have to dig down at least 2 to 3 feet so that animals don't try to dig it up. They don't smell it. And I dug and I kept digging and I saw something shiny. And I'm like, what is that? So I looked down and it was a marble from probably a child that lived here. My house is from 1895. And when I pulled it out, it was a shiny marble and it looked just like an orb. It looked like the universe. Honestly, it looked just like the universe. And his initials are Orb, O-R-B, which I found fascinating too. But I'm like, oh my gosh. So that went into his bundle. So then I put down, so how I do, and this is, I think a little bit, I'm going to say modern way, because we didn't necessarily have red cloth. It would have been maybe wrapped in like a fur. However, I put the placenta in red cloth and I put down the 4 sacred medicines into the hole after I dug it. And then I laid the placenta down, cedar, and the cedar had gone first. And then I laid cedar over top of it. And then I buried that. And so I was just blown away in tears and wanted to share the story with everybody. And then little Emmett came, the one that I birthed, and his placenta, I thought, I'm not even going to argue with spirit. I'm not going out where I wanted to go before. I went close to where his older brothers was at by the house. And I dug in a little bit different area, but close by. And I dug down in there. And after I had laid my tobacco down, I started digging and a song came right out of the earth, and it's his song. It belongs to him. And so I sing it to him quite often. And it was beautiful. And it was like, oh my gosh, this is so pretty. So listen, pay attention to what's around you, nature, the birds, the weather. So many of those things can be a part of their name, a part of their bundle, their personal bundles, again, their songs. And so that for me is how I did it. And I do know that a lot of my mothers that give birth in the wintertime, they freeze them. And I always thought, well, we never froze our placentas. However, we might have, but we have this blood and animals and such. But I had a beautiful birth in close to wintertime where the ground was, in this area, the snow was deep already. But the father had pre-dug a hole early on when the ground was still diggable and took that dirt from the hole he dug and put it into a bucket. And I do believe it was stored in the basement of the home. So when it came time to do the ceremony in November, we were able to go out and do the ceremony outside. And the ground was already ready and the dirt was fresh and we could put we did the whole thing there. And so that's another way of kind of pre-planning ahead if you live in those areas. And I know some of you do. So that was like, oh, this is awesome. They thought ahead, thinking about how that's going to work. So at least 2 to 3 feet down, you can wrap in red cloth the placenta with medicines. Always put your medicines down first. I always sing while I'm doing it. And again, pay attention to what's happening around you. Always listen and watch and observe. And there may be things that come for this child, and it's specifically for this child. That's what I have on that. Oh, the placenta grounds. There is down at Nadosepi here in Band Potawatomi, there is placental area. At least there still was. If anybody needed land that wanted to bury, they do accept. I wrote up the whole thing that if you are federally recognized tribe, you can bury your placenta there. If you're transient situation and you don't know where to bury it, you're not quite comfortable, and if this is kind of your homeland area or you feel it's right for you, that is available to you. So I wanted to put that out there as well. And this is, I kind of put that in the wrong area, but this is, you know, obviously tobacco, asema, that you put down ahead of time. And so here's our tree of life. And I absolutely love placentas, love placentas, because you see how this one on the right looks like that picture I showed you earlier, where it was embedded into the uterine wall. And the other one on the other side here on the left-hand side, how it twists and turns, and it literally looks just, those of you that haven't seen them, it looks just like a tree. It's so beautiful. And I love to show mothers, and always ask, sometimes it'll happen in the hospital, but if I do your birth, I show you how the baby lies inside of here, and what side's connected to you, and that sacred blanket, the amniotic sac that goes over. So this particular picture here, you can see the sac behind it. Actually, that would be pulled forward, and this is the side that the baby lays on or near, and that's the umbilical cord, obviously, that's connected to the baby. So the other side looks a little more meaty, and you don't have the blood vessels on it. So they have all these male names that go with it. I don't use them anymore, but this is what the tree of life that we have with our placentas. So, and as I said, we know that all of this is interconnected. Everything in life, everything in our way of being, we have a way of knowing. And that's why I tell mothers to listen to their heart. You'll know what's right for you. Find your teachers, your aunties, your mothers, if they know. There's so many different traditions across Turtle Island, across the world. They're all the indigenous world everywhere is so similar, a little bit different depending on what's available. Like fishing areas, like where you would put the umbilical cord if you were going to bury that. Some people carry it. I didn't say that. They put it in a little pouch and give some to the dad, and the dad takes care of that. But there's an intrinsic knowledge that we have. It's when we call it our knowing. Listen to that, and you will know it. It's your intuition. You'll hear it. You'll hear a voice even sometimes. And it's the interconnectedness of all things in life, and everything is connected. And putting that placenta down helps ground that baby. And it starts to develop, you can some people put a tree on top of it. And so that you always know, or a rose bush or a plant or whatever speaks to you, or put it into your medicine garden, a beautiful place to put it. If you have that place. The other thing I thought was really cool is, I love this picture. Again, it's the interconnectedness of women. And it shows us, discussing birth, life, our life ways, that transfer of knowledge, that knowing, transferring the tradition. And this one also shows the interconnectedness. And this looks like a placenta. I love it, but it's our lungs. It's our lungs. And so even our lungs look like what the placenta looks like. And so that interconnectedness is I just find so fascinating. And I'm always drawn to it and amazed by it and honored by it. So that's what I have. And I'd love to hear what you have. Miigwech.
Okay, and then do you want to go, let's revisit the chat. There's just a couple of comments, and we can start there if you like. So I'm just scrolling through, and we have people introducing themselves. We have people from Hawaii and Alaska and all the lower 48 and Canada as well, Arizona. So a question about, how long does it take for the cord to stop pulsating?
That obviously will vary, but typically you'll see it around 5 to 10 minutes, sometimes 15. But it's pretty quick. I would say more around 10 minutes. It'll totally, about 15 minutes is totally stop pulsating. Some go longer, but you'll just have someone hold it. So you'll feel it. You'll actually feel the baby's pulse in the mother's pulse there. So, yeah.
Yeah, and I just want to add that partially it depends, because sometimes the placenta is born in minutes, and sometimes it's much longer. And sometimes that process of moving all the baby's blood back into their own body is like, for even a difference between water birth and land birth can make a difference in how quickly that cord changes.
That and how thick they are. Some are super thick and some are super skinny. So that depends. If they're super skinny, it 5, 10-ish.
Mm-hmm. But the main piece is, this idea of rushing to make this separation is, the question of whether it's 10 minutes or 20 minutes is not incredibly relevant to me, because I'm not cutting this cord for hours.
Right.
And so it's that piece of, there's going to be some, whether it's actually blood or just supporting this energetic transition, patience for this period of time is what's really important.
Absolutely. Yeah. Give that baby time to transition.
Yeah. And as far as, so the next questions here, I guess I just wrote this in of, some people were asking about understanding where the cut is, and that the main thing is that we have the baby, and that their connection, that cord is extending from them, and then that we have this tie, and there's a cut on the other side of that. And whether you do 2 ties and cut in the middle, or just have a tie that's connected to the baby, that tying off is because there is just a tiny bit of just oozing of blood that can happen, and we want that to not be there. But there's a lot of different ways and traditions. I would say that in addition to the sinew and the biting, that we have so many different ways, obsidian knives, cord burning, using very sharp reeds, different just instruments and stones that were carved, that were part of our tools and our craft. And so they're, but the difference is, if they're indigenous tools, they're going to be connected to that, to earth, and they're going to be connected to those pieces, versus being about an autoclave and plastic clamps. So when the Maori birth traditions person spoke, she shared about their flax thread, and that was really important to prepare that the flax thread for instead of that sinew. And so lots of different options.
So if they're asking specifically, like, so say this is the belly button, can you see that? The belly button here, say here's your baby, and here's the belly button. I would leave about, at least that, probably more like that. They're going to look at you like, if you're in the hospital, but at least that. Then you tie here, that they're going to tie the sinew here. And then they're going to tie, you would tie here again. So now you've got tie here and tie here, and then clamp here if you need to do that. Like if you're at home, you can let it pulsate and stop, and it'll eventually disconnect if you want to do a lotus birth. But that's my answer for that as well too. So
yeah, and if it's hours later, or whenever that time frame is, that tie that's attached to the placenta isn't as necessary. It was it was really to help contain all of this baby's blood that was still in the cord that they never were able to get. It was about that. But yeah, so there was I'm just going to scroll down. I think we have a couple more.
The other thing to remember too, the reason that the reason the cord was clamped and cut so quickly was to take the baby away from the mother in the hospital. So they would cut and clamp and go. Now you say, no, the baby stays right here. And that's why it's so important. And that was one of the first things I stopped, no, leave it alone. I would tell the nurses, leave it alone. Don't touch anything, and don't touch the baby. And I would leave it clamped in the hospital way longer than back in the day that they would recommend. And just so that the nurses would keep their hands off the baby, because the baby doesn't need to be touched during that time. It needs to be with the mother on the mother's chest for that time. Well, continuously, but that was the big thing, was to get that baby from the mother over to the warmer and then start doing whatever it is they're doing over there. And that is not where you want your baby. So.
Buju, Beth, I have a question regarding the length that you were discussing. I might have missed it earlier. And you said at the hospital do a longer cut or length, but what about home birth, birth, lodge births? Is there a reason behind that?
No, just keep it as long as you can, so that, yeah, I should say yes, there in my way. So we kept it longer so that when it fell off, the dad had a portion of that to put into his pouch. So you have a significant piece that you can do different things with. So a pouch for the grandfather, the father, to put outside where you want. That's why, so that you have some room to work with, because it'll shrink.
Okay, me which.
You're welcome. Now,
there were also some comments about just that even like Margaret as a doula posted that just having gallon-sized Ziploc bags is just fine for taking the placenta home. And I know that this is different in different communities, but I feel like where I am, it's just so common for people to take their placenta that it's really, it's become a much simpler ask. It's just a lot of people don't know that this might be a ceremony that they could still hold on to, or that, they are just being reminded as an option. And so I feel like in a lot of places, it's not that it's challenging. And in fact, with the birth centers and things like that, we would really encourage people to take their placenta, because otherwise it was just being incinerated with hazardous waste and handled by family, by companies that, process it as biohazard rather than, this sacred connection to our babies. And so, it's the purpose of this Zoomcast is to just remind people that just because you walk in the doors of a hospital does not mean that you need to leave all of your ceremonies on the other side of the door. We can ask for what we need and what we want, and absolutely be just demanding that this is our right, our religious freedom.
Absolutely.
And then Beth, I don't know if you've seen the chat, but there was some comments or questions. I guess I'll just read it to you. Rayanne, do you want to read the question you wrote?
Yeah, I can read it. It was actually Christy. We were in class together and she wanted to know if it's true that with each subsequent pregnancy, does the placenta find a completely different location to attach to? Because it sounded like the care provider in that instance was saying that each pregnancy then increases the risk for it to go lower and lower and lower, or was that just a scare tactic that she was hearing?
Yes. It quite often attaches in the same spot, close to the same spot, honestly, because that area, depending on how close your pregnancies are, because that area, depending, it could still be readily like, hey, we're still kind of not open, but not totally, I don't want to say healed, but, it's still like pulling in. So, and healing. And so it could embed more likely there than anywhere else. And so first of all, even if it embedded lower and lower and lower, according to them, that's not true. But if it did, you have to remember, as the baby grows and the uterus grows, everything moves up and out, because your belly does. So that moves up and out. So it's not it is not a danger So that is a fear tactic. We're all here because our grandmothers didn't hear those. We, FYI, I saw, this is not my words, and I can't remember where the quote came from. We as humans are the only species that do not believe that we can give birth naturally. No other mammal questions the fact that birth just happens naturally. We fear birth for the most. We as humans are the only mammals, and that to me hit me so hard. I'm like, yeah, we are, and it's because these things get told to us. And I'm not negating, I'm not downplaying anybody's feelings. It's just that it's good that we have these conversations as women, and it's beautiful for me because I see so much beautiful things happening that I never thought I'd see happen in my lifetime, and it's happening, and I'm honoring all of you for that work. But it's a beautiful process, and we can take control back over again and honor that time period. And yes, you listen to it with a little bit of grain of, well, that's interesting, but come back to your group of women. We need to continue to gather as women and have these circles to say, hey, like just like this, I was told this, does this make sense? And it's like, no. So yeah, a good question.
Can I just add that I feel like that we also have to take into consideration the womb imbalances, and that so often people are not given the grace of those sacred 40 days of resting, of
Yes.
Being supportive. And so we do have more incidences of just wombs being imbalanced, and we, like, I see far more just anterior placentas and things like that. But I want to just, for numbers sake, I want to just say that as far as placentas and being low-lying, that's actually incredibly frequent in early pregnancy, like 1 in 200.
Yeah.
But it actually becoming a problem for where, and I am the daughter of a mother who, did have a complete placenta previa, where, a vaginal birth was not safe for her. But, there is this increased risk with more and more and more pregnancies, but it can happen at any moment in any pregnancy. But the number of times where it's actually a problem is very rare, and it's typically not a surprise. We see bleeding, often in early pregnancy and often throughout the pregnancy, and that where we can see that. So where a placenta decides to take root is wise. Our bodies want to be in a place that's healthy and optimum. And as far as what we're doing with honoring placenta ceremonies, and wherever that placenta took root, it's those ceremonies can still be held. It may make a difference of a normal birth, or needing to have a birth through an abdomen, but those incidences are really rare. But the common, because early ultrasounds are happening, so many people are told that they have this low-lying placenta or things like this 1 in 200 times, which is actually really, really common.
Right. And I do see the chat, and I do want to see, I think, I apologize. Is it Shana asked about, there was the practitioners, there was some concerning about the delayed of the cord clamping. There was an increase in the possibility of jaundice, and I don't know if she's still on, but you will hear that discussion. And first and foremost, many times, and I'm not going to say every time or the percentages, Native babies tend to have a higher jaundice rate for lack of a better word, than the general population. And that's our normal, in my opinion, when you have the percentages over 50%. This does not cause that to be increased. That was a way, again, I'm just going to say it, it's a scare tactic for control. Let's just get this baby out of here and be done with it. It did not increase. You get more red blood cells, yes, from that, but it gives the baby more oxygen. The baby's able to transition easier. So in my opinion, because what they're talking about is a situation where the baby was more jaundiced, because if you think about the cutting and removing, those were especially times, or could be more times that you would see that they would tell the mother, well, you don't have any ability to breastfeed. So the baby wasn't getting breastfed. The baby wasn't breastfeeding. So when a baby breastfeeds immediately, instead of being removed, the baby gets not put on, but is able to get to the breast and breastfeeds immediately. We know that breast milk has laxative effect, so it gets that meconium out quicker. So if we're not removing the baby from the mother, and we're allowing the baby and the mother to become a bonded unit that they're supposed to, and the laxative effect of the breast, the colostrum in particular, has the ability to push out that colostrum. If the meconium stool, that first stool is called meconium. It's thick, it's green, it's sticky, and once that comes out, the jaundice is not an issue. So there's more things going on than just delaying not allowing the delay of the clamping of the cord. So I would question that. I see higher instances of jaundice in Native babies, and it's our blood typing, and it doesn't affect the babies. But I don't want to medically say something wrong, but that's been my experience.
Yeah, and there's all these pieces of where they're not talking about the inductions that lead to babies that are earlier. They're not talking about the interfering about, of nursing and, supporting that exchange, and that delayed cord clamping is the pendulum is swinging back to the way we've always begun things.
Yes.
And so often it's hard to watch. I mean, Beth, myself as well, have just been a part of these birth fads of, where we see it starting to change back again. And I always just have to humbly giggle and be like, yeah, if we just would have never thought that intervening in the first hand was wise, then all of these families would have not had to go through these struggles. And so, yes, it doesn't mean delayed cord clamping or early cord clamping does not mean you're going to have jaundice or not. Right. It's not completely related. There is, blood incompatibilities, and that is a situation, but it's still, does that combat with the benefit of stem cells and having, adequate oxygen? And also we're talking about, these are the baby's own blood. This idea that if we don't let them have it, that they could somehow be stronger for it. I mean, when I just stop and think about that right. Denying them a third of their own blood, that somehow that could be wise, or more wise than letting them have it return to their body. It just doesn't make any sense.
Mm-hmm.
Regarding what you were discussing, it triggered a thought. So I'm studying to be a midwife, CNM, but because I've seen a lot of things as a doula that I don't agree with, and that I've personally viewed as harmful. So I'm hoping, that by getting my degree and getting in there, that I can, make a little bit of change and whatnot. But so you they talk a lot about vitamin K and if your child is circumcised and all of these things, and you need vitamin K because of the bleeding that could occur, and I'm thinking, okay, so then when you were talking about the blood, I thought, oh, well, would that kind of negate the reasoning behind the vitamin K? And
my take on vitamin K, and I'm just telling you, this is my personal belief only. So I'm just going to leave it at that. This is my personal thought. Vitamin K, if you start doing a vitamin K enriched diet, and you can get it ahead of time, and Rayanne has beautiful the bone broth, the soups that she makes in there's kale in there, all those things build up your own natural vitamin K. First and foremost, always remember, Creator created our bodies to do the work it needed to do the way it needed to do it. If we needed vitamin K at birth, it would be there. Yes. Now, the reason they're telling you vitamin K, and I'm just going to tell you how I feel, is that they're going to do a circumcision. And the circumcision that they do sometimes is not done very well. And I'm going to say that I learned how to do circumcisions because there were so many mothers that wanted to have those done. And I watched, and I'm not bashing every physician. There was some that did them beautifully with no blood anywhere. There were a few pediatricians that mutilated babies. And I thought, as a nurse midwife, I cannot stand here and watch that. And it had nothing to do with the fact that they received a vitamin K shot or not. I decided I needed to learn how to do circumcisions because I wanted my babies to be safe and I wanted to protect as much as I could. And so therefore, you have to remember, if we needed vitamin K, we would have it at birth. It's there, we can put it in there through diet ahead of time. If we ate a really healthy traditional diet, add a few things possibly. That's just my 2 cents worth. If anybody else has any opinion, I have a strong, my children did not get vitamin K shots, and there's a reason why. There's connection to that and sarcoma of the leg. So I have some strong beliefs on that. So I'll just leave it at that.
And I just want to encourage people that, there are some things that maybe you want to really fight for or encourage, and other things that are not as essential for you. And I see that with people as they're trying to navigate all of this, and fighting for having delayed cord clamping, and whether asking for your placenta. Like there are just choices in how you want things to go. I've been in situations where, they were not going to allow cord burning or these other ways of tending to the cord in the placenta. And, people were like, okay, fine. I will agree to the scissors because you're concerned about infection, but I want my placenta to go home with me. So it can be hard to separate all the pieces, and it would be easier if we could just make choices and have all respected, but it can be a constant navigation that can feel really hard and exhausting. And having these conversations ahead of time, I want people, even before they're planning their children, to be thinking about how they want to honor their placenta. Before conception happens, I want them to have their bodies feeling strong and prepared and ready, and that's what we can really hope for, so that there are just more options, and that people are with care providers and in spaces where they can have their wishes respected.
Yes, and I agree totally with Rayanne, the whole hearing that the baby gives blood back to the placenta for the moments of pushing to help keep the placenta firm and not to come out with baby. Yes, 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 yes. Again, our bodies are created to do these things in that interconnected space that we know. That knowing it's in the medical world has been negated, and I'm not bashing the medical world. However, I do sometimes. And then the lower levels of vitamin K also with the placenta, so that the placenta can come off and not start clotting instantly. Yes, yes, yes. That is why we naturally have the baby has the lower vitamin K levels. It's not because they need additional added to it. So having a good healthy diet, like Rhonda was saying, being prepared, being in that state where you're really concentrating on being the best person, not best, but healthiest state that you can be in, with good nutrition, good exercise, no smoking, all of those things to help that baby develop and the placenta develop healthy, and the natural way of being happens. And so that interconnectedness happens, and there's a reason why we're born the way we're born. Yeah, the medical system is what it is. We can all agree is a hella broken and not intrinsically supportive for birthing women. People, exactly, in my opinion.
Yeah.
So my thoughts about cord banking, I understand there is some value to it for your or a possibility of need for your own child. However, remember the initial part of that, they are studying the DNA of that cord blood, and so they overstudy our DNA. So just remember that happens, and so that's a decision that is personal. I don't know if anybody else has any thoughts on that, but I'm not one to be into doing that.
I mean, I just want to be clear that it means then your baby is not getting all of those stem cells.
Right.
We're making a choice to freeze for maybe later. Yeah. If there are other just people who are attending births on the call, this question of sounding like the placentas are working hard right now with people who contract COVID, particularly early in pregnancy. And I know that in all of the forums for midwifery that people are saying this. And, I just wonder, is it the, I'm also seeing, I would say that it's just this time, though. It's not even people who have been diagnosed with COVID, but that there are people who are providers who are saying that there is just a constant of strange placentas in times right now. And I think whether that person ever had an infection or not, that these are stressful times. And that, there are just the integrity and strength and rootedness of these placentas that I can absolutely understand why there would be. I know that there have been more people with abruptions this last year than I typically see, where the placenta has separated, and there's early, and I don't have the answer, but I'd love to open up to anybody else who has thoughts on that right now.
My first thoughts on that were, first of all, is the stress, and as well as whether that's been COVID itself, infection and or vaccinations. They're going to stop all the long-term studies, so we may never know. However, because of COVID, we're not many people, in particular, because pregnant women I don't want to say vulnerable, because we're strong women, and when we're carrying babies, we're strong, but you'll hear the word vulnerable. But there is a sense of vulnerability because you're caring for another child, another being inside of you. So many women have stayed home more. They're not getting out. They're not exercising. And I'm not criticizing. I'm just saying the reality is the nutrition has not been what it has been, because many people are ordering food that they can get on whatever, wherever. But those traditional foods are the things that strengthen walking and walking and walking, building it up so that those things don't happen. I think there's, again, an interconnectedness of why that's happening. And I don't think it's necessarily just but COVID could be playing a part. We don't know that. But that's my feeling. There's so many other factors that play into it.
Do you see this next question, Beth? A lot of families who are debating, there is such a popularity with encapsulation right now, and really debating as Indigenous people, what do they choose? Do they listen to the recommendations of how it's supportive hormonally and and listen to that, or do they give it back to the earth and the way that may have been done before? And some people are choosing both. But yeah, I'm curious. I get this question all the time of, is this something I should be inviting in?
So encapsulation is one of those things that is something, obviously, when I did most birth, we didn't talk about. Again, the baby's not going to get everything that it needs from the blood, from the placenta. I know that many women have gotten help from it with postpartum depression. However, I'm going to go right back to what I just talked about. First and foremost, isolation, lack of support, lack of good traditional foods, healthy foods, lack of exercise, lack of what we're doing right now, which is gathering with women. Women need to gather together. And that, to me, would possibly, I haven't obviously studied it, but I believe these things could be more, or probably are more valuable than the we don't know. I know that in China, they dehydrate their placentas, and they know the strength of it, and they take slivers of it for the 40-day lie-in, they call it, where they're just in bed and someone serves them just a very sliver of their dehydrated placenta. So I know it's been done in other cultures. I want to say, I believe, and I'm just talking personally, that we can't negate or forget the strength and the power that comes from having these discussions as women together, because we have been pulled apart farther than even the men in not talking to each other. And by gathering together and supporting one another and uplifting each other, it will be more powerful than encapsulating. However, some women, and again, like you said earlier, some women, it's a personal choice. And if you found value in it for yourself, other women may. I don't talk about it often, because I think there's other ways of getting around that postpartum depression, which is calling a doula.
So there is someone who has a story and would like to speak. If you'd like to go, that would be great.
Hi, that's me. Okay, so I attended a free birth a while back. I'm a doula. One sec. And her cord pulsed for like an hour, maybe more. And then her placenta took another hour to deliver. And that was like fine. Everything was fine. Her behavior was fine. When it came out, it was like double as thick as what I've seen before, with like placenta and then like another thick layer of clot. And my theory is that this placenta like kind of put pressure on the wound inside and like form that clot as like a reaction to that, or just, I don't know. But I just, wanted clarification on what, like, if, is that normal in like a non-medically managed placenta delivery?
In my experience, you will see that when it's not managed, you will see more of that clotting to help with that area where the placenta came from, off of the uterine wall. And it is good. And the reason it took so long is because it was doing work that was good, but it took a while to do that clotting, which we know is normal, again, because the placenta with the vitamin K and all that is a good thing. As long as she is stable and not hemorrhaging and not bleeding, that clot is not concerning, would not be concerning to me. I wouldn't say normal, because I don't like the word normal, and I'm not criticizing. I'm just saying that is a situation that you could see, given the time that it took for everything to happen. Sometimes it could happen sooner, but you will often see when a placenta is left alone, that the work it was doing was to actually help, it's stopping arteries from bleeding out. So it is a beautiful thing that the body did that, and it helped stop that. It helped coagulate it and stop the blood flow from the arteries, and then released itself. And yes, it will take time. But that's just my first initial thoughts on that.
Yeah. And she had like very little bleeding after,
Yeah.
like next to none, no
Yeah.
clots after at all. So that was,
Yeah.
it just made me think, like, what are they doing in the hospitals to like create problems other than if they would just leave it alone?
Yeah, Rayanne just answered it. They would have ripped it right off in the medicalized, and then there would be heavy bleeding. I mean, because the arteries are free flow. It's a free flow, and you'll see it. It's a free flow. But if you leave it alone and let it do what it's supposed to do, and it varies. I mean, just like my hair is a different color than my daughter's or my grandson's. Everybody's body is different, and so as long as mom is stable and she's not hemorrhaging and there's not a free flow of blood coming out of her, and then afterwards, if there's not a free flow of blood coming out of her, she's stable. Like you said, you didn't see hardly any. That's because the body did what it was supposed to do. And the time frame.
I mean, are you feeling like, Beth, that it's just a retroplacental clot is the word, of where basically the placenta's shearing off slowly, but it's kind of building that clot as it went. And then it didn't come for a couple hours, it sounds like, but there's also the reality that placenta may well have been separated way, way longer than that. And and that it just didn't, emerge, because the placenta can absolutely separate and just be in the lower uterine segment, like in that aspect, and the bleeding is there isn't a hemorrhage connected to that.
Yeah, we for sure, like we took our time, because I'd never done a free birth before, and I just I knew that going slow was better than going too fast. So
I mean, ultimately, we don't need someone else pulling on this part of our bodies, right?
No.
And so it is that situation of the pulling, like with anything, someone else, pulling against what your body is trying to do at a pace that is right for it is often will result in problems. But at the same time, what I'm saying is that placenta could have separated, at 10 minutes and just wasn't emerging.
Yeah, for sure.
Yeah, I kept checking the cord for like pulsing, and I thought I still felt it around 1 hour. So yeah.
I still feel a pulse sometimes, even when we have a placenta in a bowl beside us. So
okay.
because we've got 2 circulations going, and it's also just I also feel like it's energetic, that, you know, we're not only feeling like exchange, there's also just this energetics of it. And so, yeah, but having it, maybe it was an hour and then sat there for an hour. And that was the pace that worked for that person.
Yeah, totally. It was a beautiful birth. So yeah.
Awesome. And I'm seeing a lot about on the chat about the medical society or medical system ripping the placentas out, and they are, because they're ripping them out. And the trauma that comes with that. That's when our Indigenous doulas or doulas, however you see yourself, it is so important for you. And well, first of all, the mother and the partner have the right to say ahead of time, we don't want our placenta medically managed, but then somebody has to be watching that it doesn't happen. So there needs to be much discussion ahead of time that it doesn't happen, because the mother and partner unit is now, they have a baby and they're all, as they should, like this is what they're focusing on. And now down here, they're doing what they want. So when you have eyes on the medical community, that's important, which would be your doula. And that is valuable, so that does not happen, because they rip them out. They do. They let's go, let's get it done. They don't wait, and they don't let that happen, the slow release. So yeah, please be the eyes.
And not only with that aggression with pulling, but there's also, it is very standard for everyone to have Pitocin placed in their IV.
Yeah.
And people are not, they don't even know it.
Yeah.
And
True.
you know, that's it's called active management, and it's frequently just standard of care in most hospital settings, which, you know, often means early cord clamping, aggression with, you know, the delivery of the placenta and Pitocin immediately after birth. And that is considered, you know, very common. And most people aren't even aware that the Pitocin's placed in their IV.
Mm-hmm. Mm-hmm.
Yeah, I would say, someone said 50 minutes. I would say most places are not allowing more than 30 before moving towards a manual removal, even with no bleeding.
Yeah, it with COVID and the restrictions, it does make it really hard to have an advocate. So it would be you or the mother, like then the mother or that one visitor would be the eyes. So you have to have that discussion. Thank you for that. You would have you know, here with baby and the eyes down here to make sure that all hands are being left off of all of that.
Mm-hmm. Now, this is part of why we need all of these solutions. We need all of these, you know, buildup of care providers, because, you know, the main thing is these simple things. Like I have conversations with people about tearing all the time. And I'm like, there is a reason that there are so many people who have tears. Absolutely. And extreme amounts of sutures and things like that. When actually it's not that common, when you allow gentle birth.
Yes.
When you allow physiological unfolding of things to occur, it just, one thing leads to the next. When you allow labor to begin on its own, labor progresses at a pace that is just right for the body, and then pushing happens in a way that is, you know, in a perfect dance with the strength and energies of the life giver and the baby. And it's the same reality with this part of the birth journey of having the placenta be born. But we do need more care providers, and we need more people that are in relationship with people, because it's not that it is taught, very much taught, you know, to induce labor and have these medications on board and to rush these phases. And
Yeah.
that is how birth is taught. And
Yeah.
so, you know, that is what people are going to experience.
And is it Bianca or Bianca? I would be an advocate in your area and somehow start a conversation and get it moved in like I did with the placenta in 18 months. All of a sudden it was, so I would work along the lines of more than 5 minutes is not, that's not acceptable. It's not a standard of care. Well, I don't know if they call it standard of care. However, you could probably use some words along the lines of birth is where are you at? Are you in the States?
I'm located in San Jose, California.
Okay, so you could
Yeah.
use it along the lines of, it's our religious freedom for you to keep your hands off. It's a religious, I would start there. 5 minutes is not enough time for any placenta to detach. Wow, there's a few that will, but be that voice.
It is a challenge to advocate, and
Yeah.
it is a challenge to, you know, not have our aunties and our doulas and all of these other people with us.
Yeah.
I want to just say that is
It is.
true. It's absolutely true, that the struggle, and also that it's often, you know, there's so much that is done with rushing this part that has to do with the placenta, that, you know, Beth's right. We're just distracted. We're like trying to pray our babies in and, you know, welcome them. And so there is, you know, needing to defend having a pace that is, you know, supportive to your body, and to gentleness. It's a lot of people are just struggling with trying to be in both of those places at once, you know. It's too much to ask of people, to have to fight and defend and advocate for normal, is not a fair thing to ask when people are in
Right.
ceremony, in intensity, in places where their priorities and their lens should be focused on their baby and on, you know, this close circle, and not on what is going on. I've seen so many people who, you know, are really sad that they never got to see or, you know, connect with their placenta because they were just holding their baby and welcoming their baby and didn't even realize that everything was just, you know, pulled out and taken away.
Yep.
By the time they came up for air, that moment of being able to advocate was already gone.
You can always meet Bianca with you can always call the labor and birthing unit and say you'd like to have a discussion and bring it up as birth is ceremony and our way of being, our life ways, our culture, and this is the you know, American religious freedom. That's what I would do if I was there.
Yeah, it can be kind of hard, I think, navigating the hospital system. I mean, I definitely prefer attending home births than the hospital system, but I have noticed a lot that even when parents want delayed cord clamping, it's either 1 minute, 3 minutes, or 5 minutes, and anything past that is just pretty much they're just, you know, given so much about it. Even after they say they want it for a certain amount of time or until it's done pulsating, there's always that whole they always, you know, receive something back, and it's hard, you know, like if I'm hired on as a doula versus anything else, and it's hard advocating at the moment for that person, right? And it's not accepted in a hospital to have a doula fully advocating for the patient. It's more, I mean, at least for me, I like my job's to educate them prior to the birth and have them be able to advocate for themselves during that setting. But it can also be very, very hard and not taken very easily to have somebody speak up for you during
Sure.
a birth setting. So that always makes the situations a little bit tough, especially in that moment. Like she mentioned, where the mom's like focused on the baby, and it's kind of like, okay, we're gonna cut the placenta, and they're like, okay. At that moment, it's like, they tend to agree, and it's just really sad that the hospital system is like that, and they
Yeah.
don't honor that.
Yeah. I would start that conversation though. We did have a situation where a mother actually went on to be a postpartum doula or a doula, just so she could be present at her daughter's birth because her husband was allowed to be there, and this was in Indiana, and the father could be there, and one other person, which could be the doula, but not anybody else. And so the grandmother of the baby, got training, to be a postpartum doula, I think, or just a doula. I don't mean just, sorry, but not specifically just a postpartum doula, but she was able to attend the birth then, which was able to give that second set of eyes. And COVID has, if anything, as COVID has taught me, is that our teachings of, at least mine, is that birth is, and pregnancy, during our pregnancy, we're supposed to not be around death and sickness and negativity, have good thoughts, walk in a good way, walk softly, don't attend funerals. Sometimes it's hard. However, then we send ourselves to a hospital where there's sickness and death and dying to have a baby, even if it's in a separate hospital connected to the hospital of a mother baby unit, it still connected to that. So for me, it's like, let's start these birth centers, let's start these home births, let's start this process to get our mamas and babies. I had 9 phone calls last year, within 2 days, of people saying, can you birth me at home? And I didn't know any of them. One I knew because I birthed her mother. I birthed her at home as a baby, and I didn't know any of them. And for me, it doesn't work that way, because I need to build relationship and know you. And it was just a strange time, and they were all due within 2 weeks, and they all wanted to be at home, and I need to, there was so much I needed to understand, and it was just too overwhelming. And I just said, it was like the very first week and a half, 2 weeks into shutdown completely. And you have to have a full unit mama partner, understanding the process and develop relationship, for me, to do that. So it was a hard time, but then it hit me like, this is why we have these teachings of being in not in sickness, and not being around sickness, and not being around death, and not being around these things, because we're bringing life, forward from the star realm. And now we're doing it in these places. Not that, I'm not negating people that go there, because we're still in that process of switching back to where we started. So kudos to all of you for helping in that process.
And I want to be clear, Beth, can you just speak to, you did both, and do you feel like, how would you prepare people differently if they were preparing for a hospital birth or preparing for a home birth with you?
You mean now or then with COVID?
I think even now, because I do feel like the advocacy and information is a little bit different.
For me, I've done little births during COVID. But my first thoughts were, at home, the advocacy is going to be, you've got your unit, you've got your doula, you've got your aunties, your grandmother there. And they've been with you, hopefully, in your bubble. You've got your bubble. So that's a given. That's a safe, loving environment. However, the midwife needs to understand that bubble and be a part of that bubble for everybody to be safe. We don't understand all of COVID, and I don't think we ever will. Hospital-wise, I would educate people to again, think about, like, that was a beautiful scenario of having the grandmother say, I'm going to become a doula just to do my daughter's birth, just to be there, to prepare in that way, to think ahead of time and ask those questions. Who could be present? Who can't be present? You know, do they, you know, in some places, if you're going to go to the medical system, do they have to show their immunization cards? And if they can, and they can be there as a doula, you know, they need to understand those. So preparing in that way, I don't know if that's what you're asking, but there's a lot of questions I would ask about, can my mother be there as my, I would just say my doula there and my partner there, and ask those questions ahead of time and be prepared in that way so that they know you're bringing in a doula. But that's all I have on that. I don't know if anybody else does.
Mhm. Yeah, I guess I just wanted to also just honor that you're saying this as someone who, you know, I feel like sometimes I'm not the best person to speak about how home and hospital birth is so different because, you know, I'm only working in home birth. And the times that I am in the hospital, it's as a doula, and the power dynamic is so incredibly different than being a provider in that system, you know? And so I guess I just wanted to make space that that advocating and also hearing that those of you that are saying like I'm trying to advocate for these things, and that it's really hard to be able to be, you know, see how differently things are managed in different spaces. And, you know, for example, I've been in environments where globally, where after the birth of the baby, they do a manual removal on every single person, on every single placenta. And I wished and tried very much to speak to their hemorrhages, the partial separations, the retained pieces of placenta, the infections, the late postpartum hemorrhages. It was so obvious, but that was the way that that facility, the head of that facility required all of the training doctors to do excruciatingly painful, invasive, high risk, you know, not waiting for the placenta after 5 minutes, and to just literally have the entire hand move into a manual removal. And seeing that, and then also knowing how normal it can be for a placenta to just separate if we just pick breath, and to just separate on its own and be born and have such little bleeding, and how much the recovery and how many people are lost because that rush it, make this placenta come out within somebody else's time frame, you know, was imposed on an entire community of people. And that was often missionary doctors that came and taught these, you know, you must cut the cord right away, even if you don't have access, you know, to sterile scissors, that this must be done, you know. And so often it's really seeing these footsteps of medical colonization, and rushed placental delivery is one of them, where we're just not, it's not just that we're interfering with ceremony and causing people discomfort, it's actually harmful.
Yeah.
And actually dangerous. And that there's so much undoing that is going to have to happen, and that, you know, it's hard to do that person by person with a revolving door of providers in a space.
Yeah.
So we went a lot of different directions today than, you know, what I'd originally planned on, for just, you know, honoring the placenta, reminding that, you know, this is a part of your baby. You know, this is absolutely a part of your baby that, and that served this extraordinary purpose in growing your baby and holding it, you know, and connecting the two of you. but we are at time, and I just wanted to, see if, Beth, you wanted to just close us for today, and we can continue these conversations and keep fighting for families.
Miigwech, again, to honor all of you, and I would just like to say Miigwech, Gejamno, for all of the work and the hands, the healing hands that are doing this work, the mind, and the heart, so that this movement forward can continue, and that we can get our mamas that can be back to where they need to be in those lodges, those birth lodges, in many areas. And so I just wanted to end it that way. So miigwech, thank you guys so much.